观众朋友，大家好，欢迎收看本期的最佳方案。华人的家长啊，一般对孩子的健康呢都很关注。冬天到了要预防流感，夏天到呢要注意饮食，预防腹泻等等。但是呢，很多家长对于孩子的牙齿健康保健呢，可能都知道比较少了。很多人觉得孩子的牙齿很健康啊，有需要知道那么多保健的知识吗？其实呢，这是一个误区。今天呢，我们请来了 UD 呢联合牙科的首席牙医 George Renex 给大家介绍一下儿童牙齿保护需要知道的哪些知识。George Renex 呢已经有着30年的牙医治疗经验，目前呢他是全球有着145家牙医连锁企业的 UD 牙科的美国运营总监和首席牙医。
Primary dentition are very, very important. And it bothers me from personal experience when parents say, well, it's baby teeth, they're going to lose them anyway. No, they're there for a purpose. Some of the purposes are, one, an infant or a child has to be able to chew their food properly. That aids with digestion, that aids with nutritional absorption. You need a full dentition to speak, to learn how to pronunciate. And that's very, very important for a child when they're developing for social interactions and cognizant interactions. Baby teeth also is important, that confident smile for self-esteem. Children could be cruel, and children missing teeth could be teased at school and things like that, so that'll affect their self-esteem. The most important part, though, of primary teeth is it's a placeholder for the adult teeth. Primary teeth will be lost. They will be lost starting at the age of 6, and by the age of 12 they should all be gone for the most part. But they act as a placeholder. If you lose a primary tooth too prematurely, the other teeth will try to fill the gap. That's Mother Nature working, and that won't allow enough room for the adult tooth to erupt properly. Also, if a primary tooth is lost prematurely, there's no guide. Primary teeth act as a guide for the adult tooth to almost drop into proper alignment. Without that guide, the adult tooth will come out in the palate side, the cheek side, and again the child then will need other additional dental treatments. So primary teeth are very important. What causes a cavity is bacteria in the mouth. It's something called strep mutans. The common name is plaque. Infants are not born with plaque. It's introduced to the child by the caregiver. It could be licking a spoon. The mom licks a spoon and puts that spoon in the child's mouth. The child now has plaque. But the problem with plaque is it needs to get to a level where it causes tooth decay, pathogenic levels, where it causes disease. This is an example of a mouthful of dental plaque, and you could see along the gum lines all of that white areas. That's plaque. It secretes acid, it irritates the gums, and if it's not removed in a timely fashion, it's going to cause tooth decay. Dental decay actually many different levels. You can see some white areas along the gum line. That's decay that's just starting. It's a white chalkiness. And once the decay breaks the enamel and now fillings are needed, you can see that in multiple locations here. So the decay has gone too far down, it's into deeper layers of the tooth, and it's heading to the nerve, so it needs to be stopped here before it becomes an infection. Baby bottle tooth decay. That's when the caregiver, mother, father, grandmother, anybody, nanny, give the baby a bottle to put them to sleep, to quiet them down, things of that nature, and that slow drip from the bottle, whether it's filled with juice, baby formula, soda, I can't understand that, to be honest with you, milk, because milk has sugar, milk has natural sugars in it, will slowly drip, feed the plaque, and literally cause extensive decay very quickly on the upper front teeth. Don't put the baby to sleep with a bottle or a sippy cup, and in between meals, don't have the child running around holding a bottle or a sippy cup. The child's going to have a lot of trouble getting this replaced, if at all possible. Dental sealants is a thin coating that goes over the tooth and quickly hardens. It is suitable for all teeth, molar teeth. Typically the back teeth are given the sealants. Giving them on children with their baby teeth, their primary teeth is sometimes called, It depends on the case. If they're a very, very high risk, sealants are painless. There's no injections, there's no drillings. The procedures children find entertaining. You can make it fun too and give them a show and tell. The sealant is placed, sometimes a light is shined in the kid's mouth and it's hardened. There's no pain. Sealants last for years. Depending on the child's diet and oral hygiene, it can last as long as 10 years. But if a sealant does chip away or wears away with natural use, it can be easily repaired. I recommend it on every child for those 6-year molars, 12-year molars. Once you become an adult, unless there's other needs, the adult has issues with keeping their teeth clean, they might not be mentally competent to do it, whatever, they could be handicapped, disabled. Adults typically don't get sealants. But it's for every child, ideally for their permanent 6-year and 12-year molars, the first and second molars. Many of these I did cover already, but I do want to emphasize a few points. One is fluoride. Fluoride is so critical. It's been proven that it prevents tooth decay very quickly. It doesn't take years of consuming fluoride or brushing your teeth with fluoride. Very quickly it prevents tooth decay. It hardens the surface of the enamel surface, thus the acid attack. It makes it more difficult for the acid to break through that enamel surface. That's what fluoride does. And fluoride is no artificial man-made chemical. It's naturally found in the earth. It's a mineral. Fluoride is found in mouth rinses for children, toothpastes, gels. There's something that came out relatively recent called varnish. Almost the way you varnish a table or a wooden floor, you could paint varnish on children's teeth, especially if you see those white lesions that I showed you in an earlier slide where the decay is just beginning. You could paint that varnish on that lesion and believe it or not, it'll stop and even reverse the decay. So the decay will stop, correct itself, and there'll be no need to put a filling at that point in time. Hopefully the child keeps up with oral hygiene and diets and things like that. So fluoride is critical. It's a very common, inexpensive procedure done in dental offices every day. And diet, you're so right, diet is very, very important. You want whole foods. You want fresh fruit. You don't want fruit juices. I believe fruit juices are not recommended for children under 6 months of age to begin with. Donuts and the processed foods need to be totally controlled. And as parents will tell me, but I'm giving my kid crackers, I'm not giving them cookies. Crackers are just the same. It's processed foods, and they add plenty of sugars to crackers. I mean, the marketing world is very, very intelligent. And they won't put sugar in an ingredient. They'll use a different name for sugars. Parents will say, well, I give my kids organic apple juice. Is organic apple juice a good product? Yes, it is. Is it a good product for a child in their sippy cup? No, it's not. Again, sugar and acid. And what makes soda the worst thing possible, and children should not drink sodas, it's loaded with unbelievable amounts of sugars. It's crazy. And besides the sugar attack and the energy, the spike in the child's blood, which is not healthy, it's very acidic. Finger sucking. Yeah. I've even seen children put their whole hand in the mouth. And also pacifiers as well, kind of all very, very similar. I mean, the sucking is natural. It's a natural phenomenon, but usually by the age of 6 months, the child starts weaning themselves off that. But unfortunately, if a child is bored, hungry, anxious, tired, they may naturally start sucking all over again. And if it's done excessively, too forcefully or for too long of a period, after the age of 5, the child may have other problems if they're still sucking their thumbs, anxiety disorders, so that needs to be looked into further. Rare, but it could be a possibility if they're doing it at a much older age. It could literally change the shape of the mouth, make the palate narrower and higher, create crowding. Is the anterior open bite. When the child closes their teeth, their front teeth remain open. This affects speech development. There's lisping when it comes to saying the letters T and D in particular, and when they do say these letters, their tongue thrusts outward. There's a problem eating because now they have a malocclusion and their jaw is permanently damaged, so now they're going to have to get extensive orthodontic treatments to correct it. And again, it's a self-esteem issue for a child. I mean, obviously, they're not going to have a smile. How to prevent it? There are quite a few ways of preventing it, and I suggest parents do break the habit as early as possible. Some of the ways of preventing it is simply put a Band-Aid on the child's thumb. So when they go to, or fingers, so when they go to suck it if they're asleep, they'll realize that and they will stop, they'll break the habit. They make, you could buy a thumb glove for the child. Some parents get a little, if that doesn't work, if those non-invasive procedures don't work, then you can put a drop of some bitter tasting material, an astringent material on the thumbnail. So when the child goes to do it, they'll taste it and they'll break the habit that way. For more difficult cases to break, the dentist can make an appliance, a palatal bar, palatal crib. Some of them can be removed, put at night, removed in the day. Others are permanent until the dentist can remove them, which will not allow, there's no room for the child to put their thumb in the mouth. By the age of 1 to roughly 3, that's when you start brushing their teeth with a toothbrush using toothpaste, I recommend without fluoride. After the age of 3, then you start putting a pea-sized drop of toothpaste with fluoride. They make toothpaste special for children with appropriate dose of fluoride, or less than the adult dose, obviously, and you start brushing their teeth with that. Again, hygiene, getting them in a good pattern of hygiene, which they will last a lifetime with. They do sell plenty of wonderful toothbrushes on the market, and they sell toothbrushes and even toothpaste catered to children, and that, of course, I recommend. You want the child to be excited to hold a toothbrush. It could be a cartoon, it could be in the shape of a crown, anything. Anything works. They make bubblegum flavored toothpaste to sparkle toothpaste. Again, to get the child excited about practicing oral hygiene. Generally, of course, something that's size appropriate. I'm not going to give a 3-year-old an adult-sized toothbrush that's going to make them gag. That's not going to work. But also, the toothbrushes need to be soft. That's critical. They do sell non-soft toothbrushes out there, and that's too rough on a child's gums, a child's teeth. So you want a soft toothbrush, and of course, brush softly. That's critical as well.
听的 George Next 介绍呢，觉得还是很受益。从乳牙的保护到龋齿的防治，再到儿童的饮食和刷牙，以及怎样纠正细吮拇指坏习惯等等，让我们较为全面地认识了儿童牙科保健原来还有这么多的说道。我相信啊，已经有或者将要有宝宝的家长们一定会很有收获了。我们感谢 George Next 给我们带来这些知识。好，感谢收看本期的节目，我们下期节目再见。